Right now, like as you are listening to this, the global economy is bleeding $150 billion a year.
Yeah, it's a massive number.
It's wild. And, it's not from bad investments or market crashes or supply chain issues. It is from something called presenteeism.
Right.
Which is this invisible epidemic of employees showing up to work physically, swiping their badges, sitting at their desks, but their minds are quietly battling severe unaddressed health conditions.
It's happening everywhere.
It really is. And I mean, you hear mental health buzzwords every single day, right? Burnout, boundaries, toxic resilience. But if you're anything like me, you've probably noticed that the cultural conversation around this feels incredibly vague.
It does. It feels way less like clinical science and, well, more like pop psychology folklore.
Exactly. Which is why our mission for this deep dive is to completely strip away the corporate jargon and the social media fiction. We're diving into a massive, comprehensive guide called From Stigma to Science, a guide to mental health in the modern world.
It's an incredible resource.
So good. And the goal today is simple. We are going to look at the actual hard biological evidence, and we are going to figure out how these mechanisms actually work.
And, that shift from folklore to mechanism is just long overdue. Because while society is finally talking about mental well-being, our foundational understanding is decades behind the research.
Decades behind.
Yeah, we are currently operating in a landscape where misconceptions aren't just harmless misunderstandings. They are actively dictating corporate policy, shaping healthcare legislation, and, honestly, determining how individuals judge themselves in the mirror.
Okay, let's unpack this, because the baseline reality of what we are dealing with is absolutely staggering.
That is.
The World Health Organization recently released data showing that more than 1 billion people on this planet are living with a mental health condition right now.
Oh, boy.
1 billion. That means approximately 1 in every 8 people globally is experiencing a mental disorder at any given time, with anxiety and depression leading the charge. If you just look around your office or think about your extended family, this isn't a niche issue. This is mainstream human biology.
What's fascinating here is that despite that undeniable scale, we have a secondary and entirely man-made epidemic running parallel to it. And that is the epidemic of stigma.
Right, the stigma.
Yeah, stigma is fundamentally a structural barrier built on bad data. It thrives on the fear of judgment and just isolates people.
Totally.
Because of this stigma, millions of people who are suffering from a highly treatable, common biological condition are actively hiding it from their families, their employers, and even their doctors.
Right, and to dismantle that stigma, we have to look at the bad data it's built on. The guide attacks the myth that severe mental illness is rare.
Which we know it isn't.
Right. Even looking beyond that global 1 in 8 number, if we zoom in on just the United States, more than 1 in 5 adults live with a mental illness.
1 in 5.
And 1 in 25 adults live with a serious, highly debilitating condition like schizophrenia or bipolar disorder. Yet culturally, we still treat mental illness as a sign of personal weakness.
Yes, we do.
We have this pervasive idea that if someone just, tried harder or went for a jog, they could magically snap out of it.
Which is medically illiterate.
Right. I was thinking about this when reading the source material. We always hear these cliches, like comparing it to a broken leg.
The classic broken bone analogy.
Yeah, but that never made sense to me because a broken leg is structural. Mental illness feels, different.
How so?
To me, it seems more like having a highly sensitive, overactive smoke detector in your house. If the alarm starts screaming every time you make toast, you wouldn't tell the homeowner they just lack the willpower to ignore the noise.
Yeah.
The hardware is literally malfunctioning.
There's a much more accurate way to look at it, especially when we talk about something like anxiety or PTSD.
Yeah.
The brain's threat detection center, the amygdala, is literally acting like that overactive smoke detector.
Yeah.
And the science completely validates this as a biological medical reality. These disorders arise from a complex interplay of biology, psychology, and environment. And neuroscientists can actually see this on brain scans.
Really? Visibly see it?
Yes. Chronic stress, for example, floods the brain with cortisol. Over time, that sustained cortisol exposure can actually shrink the hippocampus.
The hippocampus.
Which is the part of the brain responsible for memory and emotion regulation.
Wait, so the physical structure of the brain actually changes size?
Yes. It is neuroplasticity working against you. And it goes even deeper. down to your genetics. The guide highlights that specific gene variations can make an individual far more vulnerable to conditions like bipolar disorder or schizophrenia.
Wow.
Now, it's not as simple as having a single depression gene. It is what researchers call a stress diathesis model.
Which means what exactly?
It means genetics load the gun, but the environment pulls the trigger.
Ha.
You might have a biological vulnerability encoded in your DNA, and if you experience a major life trauma, that condition activates. Blaming someone for a biological vulnerability that requires an environmental trigger is completely ignoring the mechanics of human biology.
So if these conditions are biological and they affect 1 in 5 adults, it really forces us to rethink who society labels as a threat.
It really does.
Because if you watch the evening news or a true crime documentary, the narrative is incredibly clear. Severe mental illness equals immediate, unpredictable physical violence.
And that media narrative is perhaps the most damaging piece of bad data we have.
Yeah.
The association between mental illness and violent crime is a powerful story, but empirically, it is a complete fiction. This negative presumption wrongly condemns millions of everyday people and acts as the primary driver for discrimination.
It's everywhere.
It is. The actual peer-reviewed evidence consistently shows the opposite of the cultural narrative. Only between 3% and 5% of violent acts are attributable to people with a severe mental illness.
Stop right there. Only 3 to 5%.
That's it.
If 95% of violence has absolutely nothing to do with mental illness, why is the narrative so universally backward? Are we just that desperate to find an easy scapegoat for violent crime?
Well, it's a psychological shortcut called the availability heuristic.
Okay.
When a rare, tragic event happens, like a mass public act of violence, and the perpetrator happens to have a mental illness, the media covers it nonstop for weeks.
Right, it's all you see.
Exactly. Because it is highly publicized, our brains incorrectly log it as a common occurrence. It is easier for society to blame a complex tragedy on a marginalized, misunderstood group than to address the real risk factors for violence.
And the guide actually lists those real risk factors, right? Things like being young, being male, experiencing extreme economic disadvantage, and a huge one, substance abuse.
Precisely. And if we want to talk about actual danger, let's look at who is actually in peril. A massive U.S. study cited in the guide found that people with severe mental illness are about 11 times more likely to be the victims of violence than the perpetrators.
11 times.
They're huge.
Yeah.
Right? They aren't the predators, they are the prey.
Wow.
Because they are often dealing with cognitive symptoms, social isolation, or poverty, they're incredibly vulnerable to exploitation. Stereotyping them as the threat completely masks the reality of their daily survival.
That dramatically shifts the picture. And speaking of shifting the picture, the guide dives into who is actually vulnerable in the first place, and this shattered a major assumption of mine.
How so?
We tend to view childhood as this carefree, resilient state. When kids act out or withdraw, adults almost universally dismiss it as a phase or just hormones.
Which is a highly dangerous dismissal.
Right.
Children are absolutely not immune to the biological and environmental factors we just talked about. The data consistently shows that 50% of all mental health disorders present their initial signs before the age of 14.
Half of all cases start before high school. That seems incredibly early. Why is the onset happening when the brain is barely formed?
Because the brain is actively wiring itself during that window. During early adolescence, the brain goes through a massive phase of synaptic pruning.
Which means getting rid of old connections.
Exactly, getting rid of old connections and solidifying new ones. If a child is experiencing early signs of a disorder, say severe anxiety or early onset depression, and the adults around them just dismiss it as a bad mood, that maladaptive wiring gets locked in.
Oh, wow.
The brain learns to operate in a constant state of distress. Delaying intervention doesn't just prolong a bad mood, it alters the developmental trajectory of the child's brain, creating lifelong, compounding consequences.
So if that wiring gets laid down early and the intervention is delayed, what happens when that kid grows up? Because I know people who are terrified of getting a diagnosis because they view it as a permanent life sentence. They assume their brain is fundamentally broken forever.
Yeah, that pessimism is another massive barrier to treatment. If you believe your brain is permanently broken, why would you endure the vulnerability of seeking help?
Right.
But the neuroplasticity that allows the brain to wire itself poorly during childhood is the exact same mechanism that allows it to heal in adulthood.
Oh, that's fascinating.
It is. The research demonstrates that recovery is not just possible, it is incredibly common. Even for a severe diagnosis like schizophrenia, which people typically associate with permanent institutionalization, the global data is astounding. It shows that 25% to 50% of patients show substantial improvement over a 20-year span.
Here's where it gets really interesting, because when we talk about recovery, we have to talk about how we get there. The treatment and the stigma against psychiatric treatment is almost as bad as the stigma against the illness itself.
Oh, absolutely.
People are terrified of medication. The common pushback I hear is, well, aren't psychiatric medications just addictive? If I take an antidepressant, aren't I just treating depression for a drug dependency?
It is a totally understandable fear, but it fundamentally misunderstands the mechanism of how these medications operate in the brain and how addiction actually works.
Okay, walk me through that.
Addiction is characterized by an immediate, intense spike in the brain's dopamine reward pathway, leading to a loss of control, intense cravings, and destructive behavior to satisfy those cravings.
Like a massive instant high.
Right. But the guide clarifies that most psychotropic medications like SSRIs for depression do not do that. They don't spike your dopamine for a high. They slowly, over weeks, encourage your brain to more effectively utilize the neurotransmitters you already have, rebuilding a stable baseline.
So it's about stability, not a high.
Exactly. Now, there are exceptions. Specific classes of medications, like certain stimulants for ADHD or benzodiazepines for acute panic, do have dependency risks and require careful medical management. But the vast majority of daily psychiatric medications are correcting a chemical imbalance, not hijacking the reward system.
And we see that same hesitation with therapy, right? There is this idea that therapy is a crisis intervention, that you only sit on a therapist's couch if your marriage is ending or you've lost your job.
Yes, treating therapy like an emergency room rather than routine maintenance.
Exactly.
In reality, evidence-based therapies like cognitive behavioral therapy are highly effective for a wide spectrum of life experiences. People utilize it to navigate standard workplace stress, grief, major life transitions, or just to recognize their own cognitive blind spots. Therapy is essentially learning the operating manual for your own mind.
Which brings us back to where we started, the workplace.
Right.
Because we spend a third of our lives at work, and the corporate world is deeply infected with these myths.
And this is where that $150 billion price tag comes from.
Yes.
When an organization implicitly stigmatizes mental health, when taking a mental health day is seen as a sign of weakness, it breeds presenteeism. Employees show up physically, but cognitively, they are compromised. They make more errors, their decision-making is impaired, and their interpersonal communication breaks down.
But the guide points out something wild about leadership behavior in these environments. It's not just that managers are ignorant of this, it's that they actively punish the solution.
This is one of the most frustrating psychological quirks in the corporate world.
That makes no sense.
The empirical data clearly shows that when employees set healthy boundaries, like disconnecting from email after 6 p.m. or taking their full vacation time, their overall well-being and their actual job performance improve. Their output goes up.
Right.
Yet, research shows that leaders still routinely penalize these employees. They give them worse performance reviews or pass them over for promotions.
Why on earth would a manager penalize behavior that increases the quality of the work?
Because we have conflated presence with dedication. It is a performative work culture. A manager can easily measure how many hours you sat at your desk. It is much harder to measure the creative quality of your strategic thinking.
Ah, so it's a metrics problem.
In a way, yes. So leaders reward the visible exhaustion over the invisible efficiency. A healthy workplace has to recognize mental health as an asset to be optimized, not a liability to be managed. When employers sponsor actual evidence-based mental health programs, the data shows large clinical improvements for the employees and a highly positive financial return on investment for the company.
So if we are losing $150 billion in the U.S. alone because middle management prefers performative exhaustion, what does this look like on a macroeconomic scale? If we zoom out, the argument clearly shifts from just treating sick people to actively preventing the illness in the first place.
Yes. If we connect this to the bigger picture, the global economic imperative is undeniable. When governments and healthcare systems invest in cost-effective, evidence-based mental health interventions, they see an economic return of $5 to $6 for every single dollar invested.
Wow, that's massive.
The guide models this out. By 2050, scaling these specific interventions globally could reduce the mental health disease burden by over 40%.
And the metric they use for that is fascinating. They talked about saving 150 million dailies. Can you translate what a daily actually is?
Sure. Daily stands for disability adjusted life year. Essentially, one daily equals 1 year of healthy, fully functioning human life lost to disease or disability.
Okay.
So when the guide says we can save 150 million dailies, it literally means giving humanity back 150 million years of active, healthy living that would have otherwise been stolen by severe psychological suffering.
That is profound.
It is. And the alternative is grim. Look at a country like South Africa. The guide notes that failing to adequately address mental, neurological, and substance use conditions costs their economy roughly 4% of its entire GDP annually. Inaction is not just a moral failure, it is economic self-sabotage.
Let's bring all these massive global numbers back down to earth, right to the person listening to this. We know the myths are fake, we know the biology is real, and we know the global cost is astronomical. But for you, navigating your daily life, what are the actual mechanics of prevention? How do you proactively build a resilient brain?
Well, science points us away from the trendy self-care marketing and toward foundational biology. The most powerful, scientifically proven protective factors are incredibly basic: adequate sleep, regular physical activity, and strong social connections.
But how do those actually work? I mean, how does sleep stop a mental health crisis?
It comes back to the brain's hardware. During deep sleep, your brain activates the glymphatic system, which essentially acts as a biological dishwasher.
A dishwasher for your brain.
Exactly. It flushes out neurotoxins and metabolic waste that build up during waking hours. If you chronically shortchange your sleep, those toxins accumulate, directly impairing emotional regulation and increasing the risk of depressive episodes.
That makes so much sense.
Similarly, physical exercise doesn't just release endorphins, it stimulates the release of a protein called BDNF, which acts like fertilizer for the brain, promoting the growth of new neural pathways.
Oh, wow.
And strong social connections actively lower your baseline cortisol levels, reducing that chronic stress we discussed earlier. These aren't just nice-to-haves, they are biological armor.
And timing is critical, right? Especially when we think back to that statistic about half of all conditions starting before age 14.
Exactly. This is why organizations like the National Academies of Sciences are loudly championing universal, school-based prevention programs. We don't wait for a kid to develop severe asthma before we talk about air quality. We shouldn't wait for a high schooler to experience a clinical breakdown before we teach them emotional regulation, distress tolerance, and cognitive reframing. Intervening early effectively interrupts the pathway from early emotional difficulty to chronic disorder.
So what does this all mean? When we take a step back and look at the entirety of Inner, from stigma to science, the narrative is completely inverted from the one society feeds us. The World Health Organization's 2025 report and the UN high-level meeting are fundamentally aligned on this.
Yes, they are.
Mental health isn't a luxury, it isn't a character trait, and it certainly isn't a sign of weakness. It is a fundamental human right. These conditions are biologically driven, incredibly common, and highly treatable. Seeking help is simply an act of medical necessity.
And this raises an important question, because moving society from stigma to science is not something doctors or policymakers can do alone. It is a cultural mandate.
Absolutely.
It dictates how you react when a coworker suddenly drops the ball on a project. It shapes how you listen to your kids when they say they are overwhelmed. And most crucially, it dictates the grace you afford yourself when you are struggling. Every time we replace a myth with a biological fact, we dismantle a piece of the wall that keeps people suffering in silence.
I want to leave you with a final thought to chew on today. We talked a lot about the actual hardware of the brain and how absurd it is that we treat a malfunctioning threat detector differently than a broken bone.
Yeah.
If we know that presenteeism is draining $150 billion from the economy, and we know that early intervention literally reshapes the physical wiring of a person's life, imagine what your workplace or your family would look like if we treated taking a mental health day exactly the same as taking an afternoon off for a dental checkup.
It would be revolutionary.
No whispering, no guilt, just routine biological maintenance. So what small, scientifically proven protective factor can you prioritize today? Is it protecting your sleep window to let your brain clear out the toxins, or is it reaching out to a friend to lower your baseline cortisol? Whatever it is, recognize it for what it is, a scientifically proven shield for your future self.